Welcome to my channel. Today I'm going to talk about the 11 triggers of postpartum depression. Let's start. PPD is a mood disorder that affects mothers in the weeks and months after the birth of a baby. While mood and anxiety disorders can start after that initial shift, PPD can start anytime during the baby's first year. Actually, up to 1 in 7 women will experience the PPDs. And PPD is the most common complication of childbirth. About 600,000 women get PPD each year in the US alone. For half of women diagnosed with PPD, this is their first episode of depression. About half of women who are diagnosed with PPD experience symptoms during pregnancies, and only 15% of women with postpartum depression ever receive professional treatment. Actually, triggers of postpartum depression can be identified. Find out what factors that tend to make you feel more depressed. Keeping a journal can help with this. On days when you are feeling extra sad or anxious, write down things you have done recently, how you were feeling, conversations you had, medications you have been taking, what the weather was like, and so on. Postpartum depression triggers can be different for everyone. However, there are 11 common postpartum depression triggers. Number 1. Sleep deprivation. If you are doing breastfeeding, it means you probably need to get up every 2 to 3 hours to do the breastfeeding, even in the midnight. It will highly impact your sleep patterns. You will not have enough sleep. For my experience, during the breastfeeding, I only sleep like 5 to 6 hours per day. Number 2, breastfeeding. A lot of women will get anxious during the breastfeeding since they are afraid they will not have enough breast milk for the babies. Number 3, pain. During the breastfeeding, pain can come in multiple ways. For example, baby can accidentally bite the nip. It will be really painful. Besides that, extra milk in the breast can also cause an unexpected pain. Number 4, weight changes. After baby is born, most of women will experience the weight gain. A lot of women will step on the scale and check if they lost any pounds every day. Some may even check every hours. The numbers on the scale actually make women more and more anxious. Number 5, hormonal imbalance. Hormonal shift after birth can result in crying, uneasiness, and mood swings. Number 6, relationship problems. The relationship here includes all, like partner relationship, family relationship, friend relationship, or even work relationship. New moms tend to give a lot of love to babies, and they want more love from others. So the relationship problem can make moms feel they lost love. Number 7, grief and loss. Because of the hormonal shift, it is extremely hard for mom to get rid of the grief and loss feelings. Number 8, holidays and anniversaries. Probably it's a surprise to you since you feel like holidays and anniversaries should make moms feel happy. But actually it's not. Like I mentioned earlier, since moms are seeking for the love, so if they did not have a good experience for the holidays and anniversaries, it is easy for them to think they are not loved anymore. Number 9, weather. As a normal people, we will usually feel down during the cloudy days. It's also the same to the moms, and actually it's even worse. Financial stress. Who doesn't like money? Who doesn't want more money? After baby is born, mothers usually need to worry about diapers, milk powders, strollers, bed, toys, a lot of things. All of those requires money. If during this time, the financial situation is not quite good, the woman will usually feel very stressed. Last but not least, changes to treatment plan. Every medicine will have some side effect, so changing the treatment plan will cause more of hormonal shift. So if you don't feel comfortable or you feel differently after change, talk to the doctors. Okay, now you know all the 11 triggers for the postpartum depression. Try to avoid them as much as you can. Next week, I'm going to share with you the other ways we can eliminate those problems. Please subscribe my channel. See you next week.